May-Thurner Syndrome, or iliac vein compression syndrome, is a common but often missed vascular problem. May-Thurner Syndrome is caused by an anatomical abnormality in which a large vein in the pelvis, the iliac vein, is compressed or pancaked between an artery and the spine. The vein is normal at first, but can become damaged from years of compression. When the vein is compressed, the blood is not able to flow freely, leading to a variety of symptoms. This syndrome is more common in women and more common in the left leg. However, it can occur in either leg and also in men. It is important to remember that this is narrowing of a vein, not an artery. It has nothing to do with high cholesterol, diabetes, or high blood pressure and is not associated with the risks of heart disease or stroke that are seen with arterial disease. The most significant risk of May-Thurner syndrome is DVT, or a blood clot. On the highway, when the number of available lanes decrease, traffic slows. Similarly, when the opening of a vein narrows, the blood approaching that narrowing slows. When blood slows, it may clot. In a few cases, the leg vein clot, or DVT, can break off and travel to the lungs, causing a blood clot in the lungs. The other symptoms of May-Thurner syndrome are more chronic in nature. The most common symptom is throbbing pain and heaviness or fullness in the leg. The leg becomes tired or achy with prolonged standing and is often relieved with rest and elevation. Another common symptom is leg swelling. However, leg swelling can be caused by many other factors. If a patient has chronic swelling in one or both legs, then, at the very least, May-Thurner syndrome should be ruled out as a cause. In addition to swelling, there are other common symptoms associated with this syndrome. Brownish discoloration of the skin of the lower legs, venous ulcers, varicose veins in atypical locations, such as the groin or back of the thighs. How do we make the diagnosis of May-Thurner syndrome at Florida Vein Care Specialists? We begin with a history, physical exam, and ultrasound of the legs. This is all accomplished during your first visit to Florida Vein Care Specialists. If the findings are consistent with May-Thurner syndrome, we proceed with IVUS, or intravascular ultrasound. IVUS is a quick, simple test that can be done in our office, and the results are available immediately. With the emergence of IVUS, we are now able to accurately determine the degree of narrowing of the vein. IVUS also helps in diagnosing other deep vein problems, such as post-thrombotic syndrome, which is chronic narrowing of the veins from previous clots. It can also help us to find acute clots that we cannot see with less powerful imaging modalities. If a patient has symptoms consistent with May-Thurner syndrome and narrowing of the veins as demonstrated by IVUS, we would then discuss fixing the problem. This is accomplished with a minimally invasive stent procedure performed in our office-based lab. The stent cures the blockage caused by May-Thurner syndrome. It can completely resolve or significantly improve symptoms. If you are concerned that you may be suffering from May-Thurner syndrome or another vein problem, then you have come to the right place. Florida Vein Care Specialists, led by Dr. Chris Meyer, has been the first choice for Floridians suffering from venous disease for over a decade, and we will continue to be at the cutting edge of vein care for years to come. Thank you for taking the time to learn about May-Thurner syndrome. Learn more about Florida Vein Care Specialists by visiting vein321.com.